Neurology is really the study of how the brain works. And I think that, your brain is made of billions of nerve cells and they all make music. And it's listening to the orchestra and listening to the music that comes out of your brain that allows you to think, it allows you to fall in love, it allows you to remember your first kiss, and it also is what allows you to speak. It's what paralyzes you if you have a stroke. It's what causes you to have flashing lights if you have a migraine or a really bad headache. But it's also what makes you dislike someone the first time you see them, for no particular reason. All of those are really functions of your brain. And I've always been fascinated by how the brain makes us who we are, and also how the brain functions when there's disease, when something goes wrong. Let's see, I was born and grew up in India. And then both my great-grandfathers are physicians. In fact, I have their textbooks here in my office. And my father's a surgeon, my mother's a microbiologist, so I kind of had to, it was a family tradition. And people often ask me, well, why did you go into memory disorders? And the reason for that is really, I love my grandparents. I just adored them. Perhaps about 60% of my patient population is older. And I love having patients who dress up to come to see me. For some people, I'm the only person who ever touches them in a month or two. And it's a very powerful thing. I really enjoy it. They're a very valuable part of what makes me happy to be a physician. I love it. Neurologists can see anything from pain of any kind, so back pain, pain from headache, to strokes and convulsions or seizures, to head injury related problems like dizziness, and tumors, brain tumors that can present in funny ways, as well as memory problems, which nowadays are becoming more and more common and are of more concern to us both as individuals and as a society. So there's a whole spectrum of pretty much anything that defines us as human beings, and that can go wrong with us can also occur because of a brain problem. So the big disorders, if it's something that deals with autoimmune problems, then you think about things like multiple sclerosis or lupus or myasthenia gravis. If you think of something like traumatic, then you would think about post-head injury related problems. Brain tumors is a whole another category. Vascular diseases like stroke, and also headaches, which really are a vascular problem because of changes in blood flow to the brain. Then there's the whole category of neurodegenerative diseases like Alzheimer's disease and dementias of different type. And then there's infections like Lyme disease, and infections that can cause memory problems or even death, like herpes encephalitis. So those are the major categories. I think that when someone has a neurologic problem, such as a headache, say, and the headache isn't getting better, and their internist has tried them on medications, then that would be a good time for them to say, look, I'd like to see a neurologist, because the truth is most headaches these days are undertreated and underdiagnosed, and it impairs and impinges on your quality of life. People can't go to work, or they suffer on a daily basis as a result. And there are simple treatments that perhaps the internist, who may be a very good internist, is not aware of, that could help. It's the same thing with convulsions or seizures, but it's far more likely that the internist would then refer a patient for that. Patients who have chronic pain, if they have really severe tingling or numbness in their hands or feet, and it's so painful that they can't sleep at night, then they may want to speak to their internist and say, look, I don't want pain medications, I'd like a neurologist to evaluate it. Neurology used to be a specialty where you diagnose and then adios, but that's no longer the case. And I remember when I was in training, we would have wards. We would have 20 patients on the floor who all had stroke. And they were we'd hold their hands and watch as their stroke progressed or didn't progress. And now, neurology has changed so much that we no longer have neurology wards in hospitals. And the reason for that is we're able to prevent many of these cases of stroke by looking at the brain and looking at blood vessels within the brain as the stroke happens. And we're able to dissolve clot within the brain and prevent the stroke from ever happening. We're able to treat patients with multiple sclerosis fairly well so that they don't have the disability that keeps them in the hospital for a month or two at a time. We're able to treat patients with convulsions on an outpatient basis so they don't end up in the hospital with seizures. So really, I think we've made dramatic strides in terms of treating various neurologic problems. You know, a lot of us now, as we live longer, are concerned with getting old. And I think nothing defines our getting old as much as our brains. When we think old, we are older. When we think young, we are younger. And I think our brains drive that, although of course we need the apparatus of our body to help us move in a certain way. And I think that over time, we're going to be able to come up with effective strategies to prevent brain aging so that we could live to be 106 years old and think like a 26-year-old. So to me, it's the last frontier in the world. I think if you can figure out the brain, you can figure out pretty much anything else. And it's more fascinating than space, I think.